Hi guys, for my presentation I'm going to be talking about high conflict divorce cases and how that affects children. I know that a few other presentations have discussed divorce, but bear with me because I have a little bit of a different take on this. First of all, I wanted to acknowledge the reason behind why I chose this topic, and that is because my best friend, her parents got divorced in middle school, and this really poorly affected her mental health. She ended up having depression for a while and going to lots of therapy sessions, which opened my eyes to the fact that divorce has such an adverse effect on children and it can affect their development. Divorce is a really common issue across the country. About 10.5 million women are getting divorced each year, and this often poorly affects children, as divorce is a category on a child's ACE test. We've talked a lot about ACE tests within class, but just to reiterate, a higher ACE score indicates that a child's development is likely to be hindered, and as a result, this may affect their mental health, physical well-being, and behavior. I'm specifically focusing on any case in which there's a custody battle, which results in the parents having to go to court, because I had a feeling that this would affect the therapist's legal and ethical considerations, so I wanted to look more into the role that a therapist plays within this situation. The first article I looked at was on parental alienation, which is when one parent represents the other parent poorly, affecting the child's perception of that parent. And a lot of times in sessions, this will cause the child to be reluctant to open up to the therapist, or the child just may talk so negatively about one of the parents. As a therapist, your goal should be to identify the severity of the child's symptoms, recognizing the fact that your ultimate goal is to look out for the child's needs developmentally, and just understanding the way that their perceptions may be impacting the severity of their mental health. The second thing you need to do is just understand the reason behind why the alienation is present. You need to take a family history assessment in order to understand the relationship between the parents and how that has affected the child over time. And finally, I found out that there is often a need for multidisciplinary services, meaning that a lot of times if there's a court case going on, there may be other legal professionals that you may need to be communicating with, or the parent's therapist. So you need to consider the presence of these people and realize that they may limit your role within the situation. Which leads me into my next resource, which was on the therapist role. If there is a court case present, a lot of times the issues that you're discussing in class, a lot of times the issues that you're discussing in your sessions are dependent upon statutory issues, meaning that they'll decide what you're allowed to talk about. Your main goal should be challenging the child's thoughts and feelings. You should recognize the biases present and how that affects their perception, especially how that affects their relationship with the parents. You should be taking a child-first approach, meaning that your goal is to advocate for the child, especially because in legal cases, they may call on you to give a perspective on how the child is doing. So your goal should be to consider the child's need and be willing to advocate for what the child needs, particularly when it comes to their relationships with their parents. It's really important to assume that both parents will support the child, never further the parental alienation present. You should be trying to build up the child's relationships with both parents, because statistically speaking, children typically develop better when both parents are present and they have a strong relationship with both parents. And finally, recognize that there are going to be different confidentiality agreements. Basically, whenever you are called upon in a legal matter, you may have to discuss some of the things that are happening within your therapeutic sessions, or you may have to inform the parents about what's happening within these therapeutic sessions, so you won't be able to be as confidential and private with their information as you normally would be able to. My third resource was a case study, and this was on a child named Adam. Adam's parents were divorced a while back, and within the marriage, the father took the primary caregiver role because the mother was suffering from depression. Within the therapeutic sessions, the first thing the therapist did was identify boundaries for parental communication. She recognized that the parents wanted to be involved in the situation, so she set up parental guidance sessions in which she informed the parents on how the child's counseling sessions were going, but she also set up boundaries for communication outside of the therapy sessions because she wanted to make sure that they were both receiving the same information and that she wasn't having a preference towards one parent versus the other. The next thing is just developing a therapeutic alliance with Adam. She recognized that he was resistant to her because of the poor relationship he had with the mother. But the therapist just really emphasized that she was there for Adam and that she couldn't control the situation or the relationship he had with his parents, but that the therapist cared about Adam's needs, and the therapist really just emphasized the fact that she was there to listen and to advocate for the child. In order to address a lot of the behavioral issues present, they used CBT because Adam was dealing with a lot of social anxiety and issues with self-stimulatory behavior and lots of aggression towards the mother. So the therapist worked on identifying the issues that were present and, again, taking that child-first approach in order to identify the reasoning behind why he had develop those behavioral characteristics, which had to do a lot with the situation of the divorce, and identify other better ways of coping. Finally, the therapist worked to support a realistic view of the parents. As I mentioned, Adam had a poor relationship with his mom because she hadn't been there to support him, but the therapist was intentional in allowing Adam to see that the mother had a positive impact on his life and to support this idea that both parents were necessary in his development and that he shouldn't be alienating one parent versus the other because statistically it's really important for both parents to be involved in the child's upbringing, even after the divorce. For my resources, the first one I looked into was a local resource called Children Cope with Divorce. This is a Monroe County one, and it's actually required by the Monroe County courts to attend, but it's just an educational program for anyone involved in the upbringing of the child on how to minimize the effects of divorce. The second one is Kids Voice in Indiana. It has 3 different programs, one for legal professionals, one to provide a judicial appointee for the child within custody cases, and the third one is just to provide a safe space for a child and the non-custodial parent to meet up. My last resource is Kids First Center, and one of the programs I found that was valuable was Kids First for Kids, which is a program in which kids can meet with other kids in a support group format so that they have an outlet in order to express their emotions and just relate to other people. There are lots of other programs for parents to develop their co-parenting skills as well. My questions to consider are, from a counselor's perspective, how would you handle when a parent disagrees with your suggestions for their child? And how do you determine your ethical boundaries in a professional setting? Is there ever an appropriate time to overstep these boundaries?